Recession coverage refers to the surgical approach to recessions. Gum recessions are a reduction of the gum within the mouth. As opposed to gum reduction through periodontitis, the loss of gum volume through recession has no inflammatory causes. There are many causes for recession. Find out more about causes of recession in the video entitled Recession. Below is a description of recession treatment. The goal of treatment is to thicken the tissue on the outside in order to secure sufficient blood circulation within the tissue. However, other factors which lead to the recession, such as tooth misalignment or improper cleaning techniques, have to be addressed through treatment as well. Tissue reproduction on the gum exterior can be achieved through a connective tissue transplant. The cuts and surgical area are so small that it is advantageous to use a microsurgery set. First, a small mucosa lobe is prepared. The upper parts of the exposed root are removed with a special instrument, thereby making gum regrowth possible. The root surface is then conditioned with the help of medication. All this is done to improve gum growth on the tooth root. Now, the connective tissue transplant is positioned and the mucosa lobe is carefully sutured on the top of the implant. Connective tissue is taken mostly from the gums through a small incision. The final step is to cover the gum with a protective plate. 2 months after surgery, everything should be healed up and the gums should be back in their original position. If the patient has also adopted better cleaning techniques, the treatment can be considered successful. The only alternative to surgery, as described above, is leaving the recession alone. However, this may lead to further complications, such as tooth cavities, sanding facets from the toothbrush, and/or sensitive tooth necks. The risks related to recession coverage when performed by an experienced surgeon are negligible. However, isolated cases may result in complications that require further measures. Every additional measure carries a risk of causing further complications that may eventually become life-threatening. Here, we only discuss specific complications of recession coverage. Some examples include no transplant regrowth, which leads to loss of transplant; wound infection, which can also lead to loss of transplant; even larger gums or bone reduction caused by wound infection, which can lead to the loss of teeth; bone infection, osteomyelitis; injury to surrounding structures such as the tongue, cheek, nerves, blood vessels, neighboring teeth, and tooth roots, as well as other related consequences; weather sensitivity, and scar formation. Fortunately, as a result of advances in medicine over the last few decades, such complications are rare today.